set up an appointment for Tuesday, Wednesday, Thursday, whatever that might look like, right? So coming out of the hospital, same kind of thing. If somebody's coming out of the hospital and we know kind of hey, I'm glad you're back home. How'd that experience go? Probably should happen the day they come out of the hospital, right? I mean, that way, one is we can identify if anything's there. I think Erica had said it earlier. If not, I dreamt it. But that initial period coming out of hospitalization is one of the highest risk times for a suicide attempt, right? If this is just coming out of a hospital, right? So getting that call in there is important. Let's do it quickly. And then frankly, let's kind of be periodic and ongoing. Let's just keep checking in. Those stories that we heard, these aren't one and done solutions, probably, right? We've ameliorated the crisis, but those root causes are still floating around, right? Mom was still, cheating on her husband, the kid's seeing it. What does that look like, right? Those things are still going. He's still upset about it. It's going to take us a while to help them move through it. So let's not just, hey, one and done, Band-Aids on, I'll see you again in 30 days. Because then we did miss that, benefit of the crisis, right? Where we can go with it. Next slide, please. So then my beloved crisis plan, right? So hopefully as you were doing those crisis risk levels, what's important again? Your risk factor scale. Sorry, I'm all tongue tied. It's been a long day. But hopefully as you were doing those exercises, as we gave you a vignette, all of a sudden it started to become even more clear why that historical information is so important. It's important in our general delivery of care. It's critical in a crisis intervention. If you don't know those things, you really got to do some really great digging to find out, or you better be really fast on your feet to try to get to it. But if you know a lot of those things, which you could, should, would, do know on a lot of folks, let's capture that on good days, on baselines, as we're working with the family, as Erica and her son's at the swim meet and her behavior coach is there. Let's add things and discuss them. Why they were, Erica and the coach were kind of sitting together watching Lorenzo, right? Have a quick conversation about that. Say, hey, I'm going to add that into our crisis plan. That was good to know. I didn't realize that about blah, 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 right? Whatever it looks like, so that we're constantly using it. We build it that helps improve our ability to have a successful intervention. However that intervention ended, what worked and what didn't work. What we thought might have worked, may not, or vice versa, right? What were the triggers, right? Each of these had a collection, but there were some clear triggers into all three of the vignettes we did today, as well as what Nicole described. There were clearly some triggers in there, right? Were there warning signs? Some there may have been, some there may not have been, right? Usually there's some warning signs, although major events can happen and you can flip on a dime, right? But usually there's a progression. And in retrospect, could we have done anything different? Could we have done something earlier? Could we have gotten in earlier on my favorite picture that shows the up and the down? Could we have gotten in earlier and not just intervene at the top of the pinnacle there, right? And if we can't, we can't, but were there opportunities? And then I guess I just leave this as a rhetorical question for you, but based upon those scenarios we just did, can you think of the clients and the members you serve now, how some of what you know about them being memorialized would be useful moving forward? Hopefully it's useful to you, but it's super critical in case you're not there that day. And I'll tell you what, when somebody's upset, they're angry, they're kicking. If you think of the two scenarios Nicole did, if I think of the thousands of people in crisis I dealt with in my career, I'm working hard, right? I'm trying to engage. I'm thinking on my feet. I'm tap dancing, especially when folks are elevated. I'm not in crisis, but man, I'm working hard. I'm putting a lot of attention into the person in front of me. I may not pull back all this historical knowledge that I knew about the person if I didn't have a chance to read that and refresh it before I show in, because we're working hard when we're engaging with someone who's elevated. And so even though you know all this information well, potentially, I'm telling you, a lot of this stuff is going to go out of your mind when you're in front of somebody who's screaming, yelling, and kicking the wall. You're going to have a hard time keeping it there. So at least skimming it and reading it as you're driving there. We're not actually driving there, but on the way there, so that you're prepared. Super duper useful. So just let that linger, percolate. Next slide. So a lot of this obviously goes, especially with the population you guys work with, towards this, family self-management, right? So, hey, let's celebrate success. We survived. Those two stories Nicole talked about, the three that Erica talked about, those were pretty gnarly, right? Those were decent, right? Folks were really having a tough time. Some of that affected family, like the one we had to have the the aunt come back, the father's drunk out there doing whatever. We're trying to connect folks to it. I mean, there's a lot of components going on there, but holy cow, we got through it. We worked together to have a successful outcome. I love the one where the daughter thought the father was going to be like so angry with her about it. And obviously he wasn't happy, but he was more hurt and worried about his daughter. He was super supportive towards his daughter, right? How great is that? Now we've infused the father into that. She hopefully will now view him as a resource, not an enemy in some of this stuff. All these great things are happening. And we can incorporate that into the family to become helping to be part of the solution. And that encourages recovery and resiliency. We see that we got through that one. I think I can get through the next one. I may need some support, but now I'm more informed of where those supports are. And maybe next time I will either call or reach out or touch before the school teacher has to do it, when I've actually, elevated significantly. So very understanding. I think I talked about all these. I think we've kind of beat it up pretty good. So we can go to the next one, although it's a very cute picture with the mom hugging her son. So let's not forget about our caregiver, right? Especially again, when we're dealing with youth, we've got a lot of family, man. They have a very important job and they are there all the time, right? We kind of pop in and out while we do a very important job. We get to go home at night. They kind of live with it. So we have to make sure we're supporting them. Make sure that different systems are working together. I don't know whether we had child welfare, but I know we had a few education folks there. It was a little hard to arrange folks. So I don't know if we were actually successful to put educators together with educators. So apologize if we weren't, but it's just this 100 people. So it's a little bit challenging. But how can these systems work together? Because one of the ladies brought up a point of, hey, that teacher really called that guy out. That just didn't seem very trauma informed. There's a lot of nice, better ways they could do it. On the flip side, that teacher's got a hard job. They're trying to figure stuff. They don't know where support's coming from or whatever. So we can start realizing these systems can work together to solve the problems together, right? So what a great opportunity when you go there and you work with that kid and then you speak with the teacher and you kind of help educate them and give them some tips and become part of that solution, right? We can start to bring together these systems to serve and become supportive. Obviously help them become emotionally present, right? It's probably draining for the family and the natural supports as well, right? I mean, I hear Erica's story. I've known Erica, geez, almost 20 years now, 15, 17 years, right? I mean, those she's working hard, right? Not only professionally, but with her child. Sometimes it gets hard, right? And unfortunately, a lot of families are broken families, right? They don't always have two family members to at least have a handoff. And Erica's fortunate. She has a 19-year-old daughter, not 3 9-year-olds, right? So she's got a little added, but not everybody does. And so it's difficult for them to stay emotionally present and overwhelmed. So how do we help support them? Because in the end of the day, if they can be more supportive and more healthy and feel more prepared, they're going to do a better job at supporting their loved one, which was going to help everybody out, right? Help the youth create. I think that's kind of goes without saying, unless there's something you wanted to say about it. And then, and help create that stability and consistency, right? Help so that we start leading towards these bubbles are going to happen, but here's what we can expect, good, bad, or indifferent. Here's how we're going to work through it. Here's how, and here's the consequences to Erica's point. And then here's what we're going to do tomorrow to kind of keep working us through. So don't forget the family, even though we're working hard. Don't forget the caregivers, because they're along this ride as well. And how do we help support it? And I just think of the aunt, right, who used to lived with her for a year, then she got ripped away from him and now coming back, right? She might have some anxiety too, not that she doesn't love her nephew, right? But maybe a year with him was enough, right? And now she realizes she's going to have to be back in his life again. And what does that mean to me? And what are my responsibilities? Next slide. So there are certainly things that we can do, and you just do a much better job on this slide, but I'll do this one. So there's certainly other trainings and education that we can help point caregivers to. Some of the good ones are ASSIST, great 2-day training for applied suicide intervention skills training. It's available for anyone, right? So you can be a doctor, nurse, a psychiatrist, or you can be, a mom or a dad or a cousin or a brother or whatever, right? So there's no prerequisite to get into it. Gives you a lot of information that's obviously available. Signs of suicide is a shorter one, much more accessible. We actually, MPAC uses that in the schools quite a bit to help with more youth identification of it. QPR, Safe Talk, much shorter, quicker, easier to digest, not a 2-day commitment like ASSIST, and ASSIST is in person, right? They are the Fidelity, they're definitely tied into their Fidelity. So even during COVID, they refused to go to a virtual model for ASSIST. So that is what it is. Not everybody can do it. QPR, you can even do that in, in an hour and a half online through a virtual training, things of that nature. So lots of other options that might be available for folks. Obviously, mental health first aid, especially for this population, mental health first aid youth, great. It's an evidence-based intervention. I'm sure that's available in all of your communities. You might even have instructors that are that. Erica and I are not for youth, but we have several modules that we do. So a lot of folks in your community are tied to that. Great places you can direct family caregivers supports so that they can become more informed. I love that you brought up NAMI. That used to be one of the big takeaways I used to do when I was teaching the cops. Like, you're going to deal with the crisis, do what you got to do, blah, blah, blah. The best long-term solution is to help that family member get educated more and more. That way they can be more in that person's life and understand what's going on. So pointing folks to education is also very effective. There's also, obviously, if you can let them know that if they're hearing talk of suicide or threats, they're obviously take them seriously. And there's many places they can call. They can call the National Suicide Prevention Lifeline. I'm not sure who that is in your community, but I know they're everywhere. Ironically, in our Arizona, MPACT is the lead one here. It's possible if you call your suicide prevention hotline and they're busy, it'll get rolled over to here. You never know, right? But they're available 24/7. And then Bucks County Crisis Line also has their own that's available for 24/7. So there's obviously plenty of resources that we just don't have to let folks feel like they're alone in this. So next slide, some common sense, right? Especially as we're talking about community stabilization, working on calm plans or safe plans or things of that nature is, how can we help support them to keep a safe environment, right? So encourage that firearms are not available, right? For folks that are experiencing these types of crises, right? We can't force it, but certainly we can recommend it. At minimum, making sure that they're unloaded or locked or have trigger guards or, whatever that may be. And guns aren't the only weapons, right? I mean, you could have a samurai sword, right? I mean, so anything could technically be, but use common sense about how do we help minimize access to that. Provide parents whose children engage in riskier hazardous behaviors with counseling intervention that help to reduce alcohol or substance abuse, right? Try to focus on some of those underlying causal issues that start creating the behavior. As Erica said, I don't know, 37 times today, what's that behavior behind it? What's the function of the behavior, right? So these are kind of the signs and symptoms. They appear to be this bright red thing that's going on. We have to see it, but what's going on behind it? How can we get there? Securing things like medications is important, right? I know I've got some type of Percocet or Oxy or so. I don't know what it was, but when I had back surgery 5 years ago, they gave me a jug like this. I refused to take any, but it's still in my medicine cabinet somewhere. I'm sure they're not as potent as before, but right. So what do we have laying around? Or if they're on meds, or if the parents are on meds, where are they at? So how do we help keep folks safely with that? If ligature, just be aware of potential ligature issues that could happen, and then ensure that the family's like kind of taking ownership of it. You gotta keep checking in. You're here on the ground. You got to kind of monitor, right? Because again, it is one thing, if we had to say what is the strength of inpatient hospitalizations, they do a good job with that monitoring. Right? The facilities are all anti-ligature and they do rounds and they monitor, right? So it does become a safe place. Not necessarily everything else that we've discussed happens there, but it is safe. So how do we help that family be aware of it? Because not everybody is aware of it. They don't live in this world that we do, right? So how do we help them get there? So next slide, debriefs. I feel like this is my last slide before we talk about our next exercise. But when we're done, right? Good, bad, and different, however this ended, we should talk about it, right? Talk about it with your coworkers, talk about it with your team, have your supervisor run a group. If you are a supervisor, how do you get the sharing? That way we can learn from each other's experiences, right? What worked, what didn't work, what was positive, what wasn't positive. Did it affect me, right? Do some of those things really trigger me? And how do I feel about it? That was kind of heady stuff. Am I okay with it? What's the function of using our crisis plans? How do we support that? And at the end of the day, we can all, you guys are always going to have to follow your operational policies and procedures in your organization. So how do these concepts fit with that? And how do we make sure that you're within your agency's policies and procedures and that these things dovetail nicely? Next slide. This is just kind of that catch-all. At the end of the day, Erica said it early, use your good common sense in your judgment. The more prepared we are for things, usually the better we can handle them and feel more comfortable with it. But when something doesn't feel right, then something doesn't feel right. Be prepared to leave. Be prepared to get safety if you need it. And the more comfortable we are with this stuff, so practice it whenever you can. Practice it on your cat, your dog, your loved one, whatever. The more comfortable you are with it, the more comfortable folks they'll feed off of you, right? And then notify your supervisor when appropriate. Okay, we can skip that slide. Good. So thank you again for doing it. We've got one last exercise. After this, it's going to be how can you kind of take some of this forward in your own organization. But I want to thank you for being with us for, it feels like 18 hours. I know Zoom is tough. I know this is exhausting, so I appreciate it. We tried to put some activities to spice it up a bit, but really thank you. Thank you for what you do. Thank you for being willing to listen to it. And when all these things come together, it really is a win-win-win, right? It's a win for our member, for our client. They feel more in control of their life. They're doing better. It's a win for you. You're more successful in your job. And hopefully your job becomes easier, right? Because you're able to get out in front of this. And it's a win for the system, right? This is where our system's trying to go with community stabilization when it's appropriate. So with that, next slides, we're going to do a little talk about what are the next steps you can do in your community. And this is another one where either either Kelly or Leah are going to be panicky because this one's got another whiteboard and we're going to do a couple little just joint activities. So hopefully you remember how to do a whiteboard. I'll tell you how to do that again, just one more time. So when it gets launched, you go up to the top of the screen. It should say view screen. You go over to view options. You're going to do the drop down arrow to annotate. After you do the annotate, you click on the large T for text. That should then allow you to click anywhere on the whiteboard. A box appears, you type, don't hit return, click, and it will appear. So hopefully that all made sense again. Everybody fairly okay with that? It's about to start. Okay. So now that you've taken this training, what's next, right? How can you use this in your organization? So you probably can't see it because we have a whiteboard up. So I'll tell you what the next slide says. The next slide says, how can you implement what you have learned into daily work life as a staff member or supervisor? So part A of that would be immediately. And part B of that would be within the next 6 months to the year. How do you think what we've discussed from crisis plans, crisis intervention, going out and de-escalating folks, coming up with risk assessment, and then coordinating posts, how do you think you can incorporate that into your organizations, how you do work? And like, what do you do right away? And it might just be, hey, I'll talk to my boss about it, right? Or whatever. And then what do you see that can happen over the next 6 months or a year? So I think we've launched the whiteboard. Take a couple minutes, start letting magical things appear. And then if you do this,
you can make it bigger.
Then we'll see what's happened. Lots of popping up.
Lots of ideas. I like that.
Working hard. I think Kelly's working hard on this one. Holy cow. Checking with coworkers, share with coworkers. I like that.
Updating policies and procedures.
That's a good one. Yeah. Share with your supervisor. I think that's great. If you happen to be a supervisor, then you can share with your staff. Somebody just flatlined. I see the flat line. All right, well, that's getting pretty full. We could probably, but so a lot of good info there. So what are some of the highlights? I'll just tell you because it's a little hard that from what I can see, but like start talking to your coworkers, right? Whether that's talking with your bosses or the folks that you work with, meet with Nicole and her staff in the schools. I like that, right? Do some cross collaboration, start updating our crisis plans, collaborating with team policies. Incorporate it into local training. I think that's a great idea, right? This is an introduction. So if I was a supervisor, maybe I could help support that ongoing. Share resources, reach out to community resources. Some of them are a little hard there. Present at unit meetings. I love it, right? Start thinking about it. And if you don't know if you have a crisis plan, that's a great place to start. Seeing if we even do have an agency crisis plan. And does your agency have a risk assessment tool? If it doesn't, is that something we can ask that potentially they create? Perfect. Okay. So I think eventually that will get cleaned up a little bit, dropped in the chat or emailed out later, I suspect, because it's a lot of cleaning up. So I suspect it'll get emailed out later, but hopefully you'll have this as the takeaway of what can we do immediately or in the near future. So then our next question. So if we start a fresh, new, clean one, which they will be working on, is what barriers do you anticipate to implementing this type of activity, and how can we work around them? Oh, still the full one.
Bear with me.
Okay, so be thinking about it. Don't type on this one, it'll mess it up. So be thinking about it. And so that could be things like, hey, I'm busy enough, right? I don't have time to do nothing, right?
I don't need more work.
So what might that look like? Well, we get more staff, or we get more support. Like anybody has more staff these days, right? But it may be, hey, I don't have time to drive out and do X, Y, Z. Well, is there a telehealth solution to it? Things of that nature. So good. All things are popping. I love it. Everybody loves the barriers. What do we got? Staff resistant, very cool. Fear of liability. Yep. Forget about training. Forget about the training by Monday. I feel like I was memorable. Wait a minute, I'm in crisis.
I better go get the mobile team.
No, Nicole's home. She'll call me on the way home.
I'm
She'll talk to me off the edge. Thank you, Nicole.
too
I'm
tired.
right
Nicole.
here. Just hang
Yeah.
on. I'm right here.
I might have to fly out there since I didn't get my hoagie last time. I'm gonna fly out.
Oh yeah, we'll do the intervention at a cheesesteak place. Yeah,
Perfect.
it's amazing.
Good. Okay. So few are still popping up. But so what are the big ones I see? Liability. Everybody's worried about liability. So one of the reasons I really stress the value of using a tool, besides I think it brings a lot of value, and until you really get good at it, you're going to miss a lot of stuff, is it starts to give you a pathway of why did I justify doing this compared to the old, I kind of feel like this. If we make a decision, we document why it fit these things. This helps lead to, if X equals Y. Things may have changed. Somebody may have done something different, but now we've got a very solid justification. So that's a big one there. Staff resistance, I agree, right? You're going to have to find ways of how do we challenge it. Some of what's going on at the macro level, just so you know, is this really is a big push everywhere across the country to get more involved with it. It's also, I know it's a big push from Bucks and from Magellan. There's the whole CCBHC initiatives, which are expecting providers to take more and more. Value-based funding is becoming more and more common, where your agencies are actually getting paid based upon performance on some of these things. And so part of that is that macro level is, are your organizations investing the needed resources to help you support in doing it? And that's an evolution. And obviously not everybody here can drive that conversation, but as value-based increases, it's in its perfect view, people get rewards for good outcomes and they actually get penalized financially for less than good outcomes. And so there's financial incentives that go up alongside this to support this over time. So those are all things that really sharp agencies can start thinking about. How can we invest ahead of time so we're really prepared to take advantage of it? Lots of good stuff in here. Overworked and underpaid. Amen. I know exactly what you mean, right? It's hard to do this stuff. How does our agency support us? I would, hope that as you get more comfortable with this kind of activity, you'll find it actually makes some of your work easier, because you can be a little bit, not up front, but in the long term, you can be a little bit more proactive.
Mhm.
So great stuff. I like it. We're going to save that and drop that into an email, I think later, right? Unless we drop it into the chat box. I think we're going to email it. So number 3, we've only got 2 more to go, I think.
Yep, I think it's 3 and 4. I think that's all we got.
Okay. So what additional training do you believe, especially for the person who's going to forget about me by Monday, whoever that person was, what additional training do you need to be more successful with working with folks in crisis? So what might that look like? So as soon as Kelly gets her breath again, we'll launch a fresh one, which isn't here yet. So don't start answering. There it is. Perfect. What additional trainings might you guys like that Monica will happily jump on and put in place? I see a little bit of Monica. I can see her face.
Mhm.
Everyone's like, I can't take another training after this. No more. Uncle, I give.
Mhm.
Consistent tool. Love it. Behavioral health diagnosis, youth mental health first aid. Good one. More opportunities for case studies for practice. Like it. All of it. Good ones. I'll live with them. Read over case studies. Very good. Specific de-escalation. Yeah. Hands-on law. Who is that? Who did that role play? Oh, it disappeared. Sorry. Yeah, whoever did that role play. Love that. I actually think that's something really good if you happen to be a supervisor or something to bring up to your supervisor, hey, can we just do a couple, mock scenarios? It's just practice this stuff, right?
I see a lot of role play.
Yeah,
And
I like the
multiple
role
people
play. I
said
think it's
that.
a great, and you can role play the risk assessments too, right? If you've
Absolutely.
got a clinical supervisor or whatever who can kind of join you for a little bit and work you through and help get you there. Or, maybe you can buy Nicole a lunch or a nice sandwich and she might show up every once in a while. I don't know. But yeah, no, love it. Love it. These are great. I think this is a definite real takeaway. Obviously it'll get cleaned up. And I don't know why it's 2 different color fonts. It's very pretty. But so I think these are great ideas. These are great things to take back to your agency and ask for support around, and what might we be able to do with that. And again, if you happen to be leadership in your organization, these are great ideas. So love it. Let's save that one. We're down to one more. And while Kelly is feverishly working on that, so I've kind of alluded to it all along the way. What do you need to be successful? What do you need from your organization? What do you need from your leadership? What do you need or that might just be your boss, your supervisor, right? What do you need from your funder? What's going to be needed to help you be successful with those things? We talked about a lot of great things there. Training sounds great and easy, but then you got to schedule it. You got to pay for it. You got to find somebody. So what are those things that you need from your organization, whether that's your direct boss or the big honcho? Or unless you are the big honcho, but what do you need or potentially from your funders to help you get there? So things are popping. We need support. We need practice, more pay. No, I think you do need more pay. I agree. Clear expectations, collaboration. I like collaboration, good supervision, money for more teams, emotional. I wonder if Nicole wrote the money for more crisis teams. Smaller caseloads, right? Yeah. Hey, so that smaller caseload is a valid conversation, right? You may not be able to get smaller caseloads all the time, but the reality is if you're going to be more invested in addressing folks' crises and not keep punting them either to mobile or to the inpatient facilities, it's a valid conversation of how do we manage that? How do we operationalize that, right? Is somebody the kind of the on-call crisis mitigator? In our system, we call it a red dot or a blue dot. So that person has a caseload, but one day a month or something, they're kind of that one that just happens to be, if something happens, you're the one that's got to go deal with it because everybody else is pretty scheduled. Lots of ways to do it, but we need to be thinking about that. Otherwise, we keep punting everything either to higher level of cares or to an external provider. So like these, more communication, staff recognition, of course, encourage consistency, practice, money, time and space for training, additional training. And we talked about some of the additional trainings. I love it. I think that's another good takeaway. Yep. And I agree, additional staff. And if you can find them, tell us how you did.
Yeah,
because you've got a national best practice right now if you're able to hire seamlessly. There's clearly a large gap of workforce. So hopefully you guys are more successful than we are out here. Love it. I think we can call that a day, Kelly. And then I think the plan will be to send them out later, right? Probably, Leah, or you're going to try to do it today, right? Okay. So those are at least your ideas and thoughts. We'll try to clean them up a little bit for you so it's a little bit clearer, but hopefully that gives you some ideas of what you can take back on Monday and say, hey, I went to this training. Here's what we were thinking about. Here's some of what we thought. Is there any way we can do anything to help support it? Because we spent a lot of time, but it's not a lot of time, right? And we had you do 3 exercises using a risk assessment tool, but it was what it was. It was a virtual environment, right? You're going to need to work through these types of tools and use your own tool to become more conversant and comfortable with it, right? Nicole's folks felt very comfortable as she told those stories because they do it all the time. If you're not doing it all the time, you got to work those muscles. You got to build them. And probably the easiest, safest way to do it is in some mock staffings, role play, whatever. Do it together as a team, and then probably call your boss while you're out there saying, hey, here's what I did. Here's what I see. Here's my recommendation because of X, Y, and Z. What do you believe, boss? And they'll say yes or no, right? That's their job, but good way to kind of reinforce it. So with that being said, we intentionally needed to leave Leah 10 minutes at the end to cover any housekeeping, final CEUs and blah, blah, blah. And I think we did it exactly, giving you 10 minutes, according to my bad watch. So it's all you, young lady.
I think you did perfect, Nick. I mean, looks good to me. I'll drop the CEU link in the chat box momentarily. Monday, I will also email out the link for those who missed it in the chat today, the PowerPoint, all the additional handouts, the whiteboard exercises that we did too. So that way everyone will have everything in one email to make it easier. Thank you again for attending today's training. If there's any questions for Nick or Erica, this would be the time that you can unmute yourself. You can put them in the chat as well.
And I just want to thank all of you. I want to thank Monica for pulling this together. I want to thank Magellan for spearheading it. And frankly, all the folks from Magellan that were on to make this. This was, virtual training is what it is. There was a lot of technology stuff going on. It really went quite seamless. We started this conversation, I feel like it was 10 months ago, Monica. So it's been a long time coming. And we had originally held out this hope that maybe we'd be in person, but we didn't think so. So I want to thank all of them for doing it. I want to thank all of you for giving us your Friday. I know this is a tough way to learn. It's a tough way for us. It was great to see so many faces at any given time. I could see 30, 40 folks at once. And for a guy like me, it made it possible to get through the day. So I appreciate you doing that. So we've got a few minutes if you've got something. Otherwise, we're happy to sign off, whatever's best for you folks.
I'm saying thank you. Great resources, great presentation. They really appreciated everything. Very informative. So just giving kudos to you. Everyone can certificate of attendance and CEUs. So whoever needs it based on that information. I don't have questions, just a lot of thank yous, and have a nice weekend.
Leah, there was a question about where's the link for the CEs.
Just added the link. So for those who want to use it, if not, like I said, it will be mailed out on Monday.
Thank you, Nick and Erica.
All right.
And Ellen,
Thank you,
for all your
everyone.
help. Yes, have a great weekend.
Monica.
Thank you.